later.
Well, as we've been hearing, pharmaceutical companies have been told they must stock up on medicines to cope with a no-deal Brexit. Dominic Raab says there needs to be an additional 6 weeks' supply stored in the UK. A no-deal would also mean all new medical products coming into the country would have to be approved. With his assessment of the government's advice, here's our health editor, Hugh Pym.
There have been fears that supplies of medicines could be held up if there's no deal and there are customs delays at channel ports. The worry was that essential medication for patients, which has to be imported, might not be available. Hospitals and pharmacies weren't sure whether they should stockpile, but ministers are telling them there won't be a problem. The government has today written to hospital managers and others in the health and care system saying they don't need to worry about building up extra supplies. That will be taken care of. At the same time, doctors have been urged not to sign longer dated prescriptions for patients who might feel they need extra medicines. Ministers have told the pharmaceutical industry to build up 6 weeks' worth of supplies of medicines which are imported from elsewhere in Europe.
Well, the letter to the NHS really is a first step, and I think that hospitals and other organisations throughout the NHS will be expecting more detailed guidance. I mean, these are organisations that are used to emergencies, but this is a pretty unprecedented situation.
If there's no deal, drug companies will have to get new products approved twice, once by British regulators and once by their European counterparts, adding an unwelcome extra layer of bureaucracy. Hugh Pym, BBC News.